Hello, everyone. Welcome again to our special series, Demystifying Mental Wellness at Work. My friend and I, Susanna Harkinen, we decided to, get together and do these series because we come from a place of service. It's our passion to address mental wellness. It is Susanna's job to address mental wellness in the workplace. Specifically, that's her mission and passion being aligned. And for me, it is understanding that we cannot do business, we cannot do work, we cannot do life without catering for our mental wellness and making sure that it is optimal as much as possible. Susanna, hello.
Hey, good morning.
Good morning to you. Well, today's episode, as we said and shared in the previous couple of episodes, we're going to be tackling a specific subject each time. Again, we are open to your questions and suggestions and recommendations. So we are receiving that as it comes along, and we could shift a bit in what we're talking about. But today we want to talk about the most common issues when it comes to mental wellness within the workplace. And I know, Susanna, we kind of touched on this in the previous episode, but we want to delve a bit deeper into specifics, what it means, how to identify if we're going through it, and more importantly, possible strategies and tips of what to do next.
Right. Yeah, exactly. Okay. And this is a very important topic.
Exactly. So we've been hearing the terms anxiety, depression, stress, and substance abuse. Even these are some of the symptoms or some of the repercussions that could be possibly have been triggered by issues in the workplace and have triggered our mental wellness one way or another. So could you kind of just start dissecting one by one for us, please?
Yeah. What is what? It's true that we actually use all of these terms pretty carelessly and loosely.
Yes.
Nobody really knows what burnout is.
Yes.
What is stress? It's very convenient term. I'm just stressed. But actually, it's really, really important here to make a distinction between what's normal, for example, sadness because something has happened to you and you feel sad, and what's actual depression. Mm-hmm. There's a whole range of between feeling sometimes sad and feeling clinically depressed.
Yes.
But let's walk through them one by one because it makes it perhaps easier for people to understand. So just to start with, it's really, really common to have these things. So roughly 40 to 50% of people at the moment have one or two or three of these issues. So if you're not feeling well, or if you're questioning yourself, if you just can't get out of the bed, or whatever you're not feeling well, and you know that it's linked to your mental health, mental wellness, you're not alone.
Yeah,
it's really important to know that. Also, we know that workplaces are a big factor in impacting people's mental health.
Mm-hmm.
So let's start with burnout, because burnout is a very convenient term.
It's very common. And as you said, we use it a lot. And sometimes we don't use it when it's applicable. And I think we
don't.
Yes.
No. And actually, burnout is not a diagnosis.
Okay.
So you can't diagnose burnout. You can diagnose depression, or you can diagnose anxiety, but you cannot really diagnose burnout.
On a psychological
level. Only as late as last year was it included in the WHO's list of,
really?
things. It's not a diagnosis, but it's can't remember the term right now. It doesn't matter, but it's sort of like an indicator of. I'll have to check that term. Actually, okay. I'll come back with that. But the point is that it has been now recognized as something that's really, really important in the workplace, and it's prevalent.
Okay.
And there are certain things that are linked to burnout. For example, constant fatigue, sleep disturbances, high anxiety, memory loss or troubles with remembering things, slowing down, not being able to, cognitively, to be able to keep up, and sometimes weight loss, weight gains, things like that.
Could we
there are many.
Yeah. Excuse me. Sorry. Could we say that burnout is one of the things that really also manifests physically in our bodies?
Absolutely. Absolutely. Burnout is not in your head.
I was just about to say, it's not just a mental state. It's actually it has physical ailments and physical symptoms that go along with it. And that makes it more prevalent. That makes it more diagnosable.
Not so much more diagnosable, prevalent, because depression is also in the body. Anxiety is in the body. These are all body-based things. They're not only in our minds.
Yes.
I think that burnout is a very, very common. I wish really whether we would be able to specify it even further. Mm-hmm. But the important thing here is that burnout has been recognized as an existing condition.
Okay.
So it's not just in people's minds. You couldn't go to a doctor before and have a burnout diagnosis.
Yes.
Yeah.
And is burnout something that now we could say it's a result? Oh, no, it happens because of being overworked, or just being triggered at work continuously, or being stressed, or just, the parasympathetic nervous system just being triggered on the fight or flight mode. Yeah. So would these be very common causes of what would cause burnout, or very common reasons what would cause burnout?
We don't really know where burnout comes from.
Okay.
I mean, there are many theories and ideas of where it's coming from. There's some really interesting recent research. Actually, a friend of mine, Dr. Gutierrez in Germany, she published a research last year about burnout. Mm-hmm. And she found out that, for example, appreciation by your peers, and especially your boss, is actually a preventive factor for burnout.
Wow, that's interesting.
Yeah. So for me, the way I see burnout is a condition that is not because you have too much work.
Yes. Okay.
By and large, it's really a mental exhaustion, and it normally builds up over time. This is why self-care is so critically important, because that's also small steps, daily steps.
Yes.
If you don't do that, then the burnout piece takes over, and it's overwhelming. And when you get to that burnout state, that state when you cannot no longer function, or you just crack and you start crying and you're a sobby mess. I mean, that happens to some people, not to everybody, but that happens too. When you just can no longer even consider going back to work.
Yes.
That really heavy duty burnout. It's much harder to come out of it than when you take care of yourself early on.
Okay, so
it can take years. I mean, from a physical perspective, you ask about the physical side.
Yes.
From a physical perspective, it can take 2 to even 4 years to recover from a burnout.
That personally happened to me. It was just understanding, because my burnout was so extreme that it physically manifested into illnesses and ailments in my own body.
Exactly.
It really took me a very long, I think approximately did take me 2 years to kind of recover, where I was finally at a physical and mental state where I started saying, okay, now what? And understanding and processing through everything that had happened, and letting go of some of the anger, the residual anger that had, kind of did that. And I think it took me another at least 2 years of letting go of the pain that came along with the burnout and being within that work environment. And these are all
the shame. There's a lot of shame in burnout.
That too. I think there's so many ingredients to this recipe of burnout that we find it difficult sometimes to recognize that this is one of the ingredients. We think it's associated to something else. Okay, from that perspective, burnout versus stress.
Yeah, let me just add something here, because I think it's really important for people who may be borderline burnout,
yes,
or heading towards that direction. What I see regularly are people who actually end up in that state. It tends to be women more than men. Mm-hmm. but I could be biased because women seek more help than men do. But that when they actually have a burnout, or they have to take a sick leave, when the doctor says like, no, you cannot go back to work, whether they have a diagnosis for something else, it doesn't matter, but they're not able to cope with work and what's happening around them. There's incredible amount of guilt, incredible amount of shame. It's like as the world would come crumbling down because I am not functioning. And what will happen if I don't go back to the office? 1 week away, 2 weeks away.
Yes.
What are people going to say? Am I going to be a complete loser? I will lose my job. And then there's this whole anxiety piece that starts going like, oh my God, everybody will think that I'm a loser. I can't, and this is a really, really common thing.
Yes.
And instead of taking that time and saying, okay, I'm broken and there's something that I need to listen to. My body did this for a reason.
Yes.
My soul did this for a reason, if you want to take it to a higher level. And giving it time and giving it that space. Trying to rush things and trying to fix your burnout quickly actually is a recipe for disaster.
Yes. Because you'll only be addressing the superficial.
It's superficial, and that same nervous system thing that you mentioned earlier, the autonomic nervous system, it's still there. It hasn't gone anywhere. You may have taken 2 weeks off or 3 weeks off, and now you feel better because you were able to chill, but you're not okay.
No.
And going back to where you were 3 weeks earlier is then probably going to just make it worse the next time around, because it's almost guaranteed that the next time around will come. And people who go into full burnout, again, this is just my observation, this doesn't come from any research or statistics. What happens is that they say, 2 weeks, okay, I'm fine, everything is cool. And then a month later, 2 months later, 6 months later, same thing, worse.
Yes.
And you know what I'm talking about?
Yes, and
yeah. Or then in the end, accidents. You break your leg, or you cannot move. Something makes you immobile. It's almost like guaranteed that it gets worse and worse and worse.
Or your head is down the toilet and you're throwing up blood.
Sorry?
Or your head is down the toilet and you're throwing up blood and you physically can't stand anymore. That was my personal.
Yes. There you go. Exactly. Yeah. And then it gets to a point where you are so sick that the recovery will take much, much longer.
Yes, that's true.
Your case.
Yes.
My case, when I had my first burnout, I've had two. I was relatively young and in relatively healthy. So, my recovery was reasonably fast, and I wasn't at the very end of it. I was sort of like mid-range kind of burnout.
Yeah.
But my gosh, did it take time? Yes.
Yeah. But the element you brought up, and that is, it's amazing that, yes, that's an observation that you're saying. And it's that we also have burnout comes along with shame and guilt. And I remember definitely I could relate to that, because there was this part as well, that voice in my head is like, oh, they were right. I can't manage this. I can't do it. I can't be a mom and a business owner and a student. I was doing my doctoral studies then, and an expat, and I can't do it. And something's got to give. And this part, then it triggered me to do more to be able to sustain. But in essence, yes, I'm deprioritizing myself and my own self-care and everything.
Completely.
And it's getting worse, and it's getting worse. And you kind of try to fight it off, and that doesn't work.
No. That's why I advocate, this self-awareness and if possible, trying to take a step back and see, where does this come from?
Yes.
For real?
Yes.
Where does the shame and guilt come from? If you can find somebody to help you, that would be ideal, because sometimes we are so blind to our own.
That's true.
Own issues. But there's always a reason behind it. And being a performer and having to, being a high achiever. Also, burnout does there's more burnout among women, for example, high achieving women. Those girls that have always been good at school, good at university, have it all together. So it's more prevalent in that group.
And that's a message, I think, that when you are going through this, you're not only supposed to stop and start treating the symptoms and everything that else is coming up. It's go and seek someone within the mental health professional to go to the root causes of why you could be pushing yourself towards the burnout barrier over and over again, or even just once, just understanding what are the root causes driving you in that direction.
Yeah. Yes, exactly. And there's another important piece, and that is also the medication. You know, oftentimes when you go and see a doctor, because usually you get sick leave.
Yes.
They often propose medication.
Mm-hmm.
I'm not against medication. By all means, it can be a helpful thing for people. But the thing is that ideally you would want to work on yourself and see what are the causes for the burnout and not try to mask it.
Yes.
So if you take medication, if you choose to take medication, do combine that with therapy as well.
Yes.
If possible.
Yes, because that's what happened to me. The doctors, I went, of course, for my gut and everything, endoscopies and medication forever. And I asked my doctor, I'm like, till when? He's like, yeah, you're on it forever. I'm like, how about going to healing rather than just masking? Because again, with the gut, all you're doing is just suppressing everything that's happening, but you're not actually healing it. I don't want to be on a pill for the rest of my life. I want to know what's causing it and hopefully reverse it. No, it's irreversible. No, there isn't anything reversible. I think that's the thing that I learned from my health coaching and metabolic balance and everything. The beautiful fact is every cell in our body regenerates within a 7-year time frame. So literally, we are not more than 7 years old. Our bodies are not.
Yes.
And if we look at it from that perspective, look at how you can reset. You can work on regenerating healthy cells for your internal organs. And that for me was like, okay, wow. Okay, now let me look at the ingredients I put into my body. I'm not 100% compliant, but understanding that even it starts with what am I shopping? Even it starts with the grocery shopping. What are my surroundings? What are my environment? And then accordingly, how can I do this? So that's why when we talk about healing, it's not a switch on, switch off. You're not going to wake up tomorrow and you're better. It's going to take time and it's going to take consistent effort. But with the understanding that I am healing, but I'm also regenerating. And I'm getting a fresh start. Literally, your body gives you a fresh start. That's just the way it works.
You can't speed the process. You know, everything has its time. And also when it comes to healing, as you know, I'm really pro alternative medicine and approaches because they can be really, really, really helpful. But in these sorts of situations, it's also good to find the balance. Only you will know what's right for you.
That's true.
You know, sometimes you get these advices from people saying like, oh, you should take essential oils and you'll feel better.
Yeah.
Or, you know, do this, do that, and will feel better. So meditate some and do some breathing exercises and you'll feel better. By all means, those things are good. But if you have a full-blown burnout, it's not going to be an essential oil that will fix you. Only. It can be one of the things that you do, but try to be as holistic as you possibly can.
Okay. So burnout versus stress.
What would you like to know about stress?
Let's start with this. How do we distinguish between stress in the workplace or as a result of being at work versus burnout? Do they manifest the same way in our bodies? Do they carry the same symptoms from a diagnosis even perspective?
You know, stress is also an interesting thing because it's really not a diagnosis.
Another one. Okay.
Yes.
Okay.
If we look at it purely from a medical clinical perspective, depression is a diagnosis, anxiety is a diagnosis, substance abuse is a diagnosis, bipolarity is a diagnosis, for example, to give a few examples.
Yes.
But stress and burnout are those terms that don't have a clear distinction. I mean, they're not diagnoses.
Yes.
There's a list of things that I, link to those things.
Yes.
But you cannot say, this person is stressed because they are fulfilling these particular diagnostic criteria.
Is it because there are wider umbrellas of symptoms underneath it that could be associated with other elements or other inputs?
Yes, I do think so. And being consistently and on long term on stressed can then lead to burnout.
Okay.
So
it's
that
kind
is
of the progressive state of being stressed.
Exactly.
Leads to burnout, one way or another.
Exactly. Yeah.
Okay.
Yeah.
And
being stressed stress is a trigger for things like depression and anxiety.
Okay.
So being on high alert, constantly hypervigilant or vigilant for your surroundings, having too much going on, having a little bit of anxiety is healthy. It's part of our survival mechanism. It's part of our nervous system.
Mm-hmm.
However, if you are constantly anxious, and this is linked to stress as well, it's a vicious cycle. And then stress makes you more anxious, and then more anxiety feeds the stress, and so on. So it can be and then that leads to burnout.
Stress is also linked because, as you said, because we're always on high alert and everything in our autonomic nervous system is being triggered. That's also means that our bodies are secreting the adrenaline and the cortisol, and that leads to the physical symptoms because our bodies can't take that constant secretion.